Hello! Wait, hold on. Hold on. Mic test, hello. Okay. Hello, everybody in chat. Hello. Okay. Oh, you know what? Hold on. I need to set up something. Okay. Alright, this is my first time doing a more proper medical hand cam stream. And because of the positioning of my computer and the webcam, I have to look so far away. Hold on. Suture time, yeah. Hello everybody. Hello, good evening. How's your day, everybody? How's everyone's day today? I hope you guys had a good day. Wait, I'm gonna set up the chat on my mobile phone so that I don't have to look onto my side just to see see the chat. And again, yeah, the chat is going to be delayed for me again. Hold on. Let's see. Let me fix this. There we go. There we go. I want to be able to see the chat. Is there an easier way to see the chat on my phone? This is hard! Holy crap! My font is too tiny on my phone. I gotta make it larger. Hold on, guys. Okay, let's see. Some people are physically in pain. My legs are screaming, but I'm fine, Doc. Just did my first complex oral surgery. Wow! First complex oral surgery. Nice. Been practicing sutures in my free time, and horizontal interrupted takes forever. Wow! I'll be showing that one. Don't worry. I'll be showing that, and it's actually I don't use that suture that much actually. Horizontal mattress. I don't use horizontal mattress sutures that much. Okay, you know what? I can't find the... I am shit at using Android phones. I don't even know where you change the font. This is... I am an iPhone user. I have an Android just to look at my chat and I can't even see where the font is. Tangina, asan ba yung font dito? Fuck Samsung. Fuck Android! Ano ba to? Oh, you're on a treadmill, Henpai? Okay. Okay, I think I found it. Oh, here we go, I found it. Okay. Took forever, but I found it. Okay, let's go back to YouTube. There we go! The chat's a lot bigger now. Okay. I am just gonna... Alright. Okay, that's much better. Now I can see the chat. I can see the chat now. A lot better, and I don't have to turn my head so far away. Okay. Alright, so... Hello, guys. Welcome to my stream. How's my mic, by the way? How's my voice? I hope the sound is okay. Mic test. Do you guys hear the electric fan at the back also? Because I have the electric fan faced towards me. It's good. Okay, that's good. Okay. Because I have to, move the freaky... Okay, there we go. Okay. Mic all good. Okay, that's good. Alright, so tonight tonight is more of a hands-on kind of, a hands-on, I don't know, medical education stream. We're gonna talk about sutures. The sutures used in surgeries and the art of suturing. Okay? Alright. So, let me lay down. We're gonna start first with. I'm gonna show you guys the different kinds of sutures. Okay. Wait, hold on. Let me ready my hand cam. But I'm gonna get rid of the chat. Hold on. The chat's gonna go. Sorry, chat. You're gonna have to go now. You're gonna leave. How do I pick up chat? Goodbye, chat. You're gone. All right. Oh wow. Oh wow. Okay. Hold on. Okay. Hold on. Do you guys see this? Do you guys see this? Yeah, you're all gone. I'm sorry, chat. You have to leave. I'm sorry, chat, but you have to leave. Let's make this a little smaller. Let's put this right here. There we go. Okay. Now, what I have here is the sutures. I have the sutures over here on my left, which is your right side, and then I have stuff here, surgical instruments on my right, which is on your left. Okay, so we're gonna talk about the different types of sutures. We have two types of sutures. Okay, we have two types of sutures. One is the absorbable suture, and the other is non-absorbable suture. Okay? Let's type it down. Let's type that down. I have to type it down. Text. We're gonna type that down, okay? Suture. Absorbable. Okay. So we have absorbable. Alright. Absorbable suture. Okay. I will show you the absorbable sutures, okay? So, absorbable sutures. Yeah, let me lay these down. This one. I'll put this on the side. Let's put this back. This somewhere that's here. Does suture refer to the needles, the string, or both? Both! Okay, here, I have laid down here a bunch of sutures, okay? These are just samples, okay? So we have absorbable sutures. When you say absorbable sutures, these are the ones that are absorbed by the body in the body through time. Okay? It's absorbed in the body through time. And we have different types of absorbable sutures. Hold on. There's a table here for that. Sutures. I had that table saved somewhere, but I forgot to set it up here. But I will show you the types of sutures here. Hold on. Let me show it to you. Yan ba yung natutunaw? Yes, yan yung natutunaw na suture. The absorbable sutures are the ones that are absorbed in the body, or what they say, yung natutunaw. There is a table for that. I saved it a while ago, but then I forgot to set it up here. So I have to search for it again. absorbable. Oh, here we go. This one. This is a good one. I found one. Here. Okay. Image. Let me show you guys. Hold on. There we go. These are the types of absorbable sutures, okay? Alright. So we have different types. One is polyglactin, the other is polyglycolic, and there's polyglycanate, polydioxanone, chromic gut, and surgical gut. Okay? The ones I have here are mostly polyglactin. Like, for example, this one. And this one. Or polyglycolide. Like this one here. This one. Okay, let's see. It's not focusing. Focus. Do you guys see this? It says Novosin. Novosin 4O. So this is a polyglycolide polyglycolide suture. Okay. This is absorbable. And if you notice, a suture, if a suture, the cover of the suture will always have the shape of the needle right here. This is how the needle looks like and its shape. So this one is a cutting needle, DS19. I haven't memorized the codes, those DS19 and all that, but what I do is look at this, and this one is a cutting needle. A cutting needle means that the tip of the needle, or the tip of the needle has a blade. So it's really, really sharp and it cuts through the skin. And then, also part of the suture, this one, here's a number. You see that? There's a number. This one says 40. What's the other one? This one is also... This is a polyglactin suture. Okay? So you can see it also has this. It says here... This is the shape of the needle, and it says tapered? Wait. Taper point. So this is a round needle. They call this a round needle. So this one, unlike the cutting needle... Oh my god, someone's calling me through... Wait, hold on, guys. Biglang may tumawag sa Viber. Wait, sorry. Get that later. Okay. What I'm saying, this one is a round needle. Or a tapered needle. And 2O. Okay, this one has a number 2O. This one is also 2O, but see, there's a difference between this needle and the other needle. Okay? Why would you need a bladed needle? That sounds terrifying. Because bladed needle is usually for suturing the skin. Okay? And round needles are for suturing tissues underneath the skin, or like, you know, like bowels or any organs inside. So cutting needles are usually for skin, and then the round needles are for internal organs. Okay, that's a very important difference. Okay, that's a very important difference. Now, the numbers on the suture. So you have a 2O, there's a 4O. This one has 5O written on it. This one is 4O. There's also like 3O, there's 1O. There's also a suture that's just called O. So what happens is, the larger the number, if you have a larger number, it means the suture is smaller. Okay? That's why the 2O is actually bigger. The needle the suture and the needle are bigger compared to a 4-0. A 4-0 is small. Okay? Okay. Alright. Alright. So, a polyglactin suture. This one is usually used, so the purple ones here, these are polyglactin sutures. These ones. These are absorbable. They are also called braided sutures or multifilament sutures, and I will show you why later. So, and then there's braided and monofilament. I'll show you later why they're called that way and what the difference is. But anyway, if you can see, polyglactin sutures take around 30 days to absorb into the body. Okay? So let's say you have a wound and they use this to suture your wound. It'll take 30 days for this to be reabsorbed in your body. Okay? And then we have here on the list polyglycinate or polydioxanone, which I don't think I have here. This is polyglactin. This one is this is also polyglactin. This one is polyglyco. Well, actually, this is polyglactin also. They're all polyglactin. I don't have an example of a polydioxanone. But anyway, they take longer to absorb in the body. Okay. And then there's also what we call a chromic gut or a catgut suture. These are the ones that dissolve after like a week or two. These are the ones usually used in circumcision. Okay. Circumcision. This is a catgut or a chromic gut. Or plain suture. Chromic sutures. Okay? Hi, thank you for all the patience you help. Thank you, Nick Shakespeare. Thank you. Alright! Next! So we're done with the sutures. I forgot to tell you, there's another one. So aside from absorbable, let's take this out. So there's absorbable sutures. We also have non-absorbable suture. Okay. And the non-absorbable would be this one. These ones. Okay. What is the most often used suture? For absorbable, it would be polyglactin. These purple ones. Yes, I have. These are not red, actually. These are pink. These are pink ones. Okay, non-absorbable sutures are basically sutures that are not absorbed in the body. So we have this one. Silcum. This is a silk suture. Okay, it's made out of silk. Wait. Is it seen? It's not focusing. There we go. It's a silk braided suture. And then you have the round needle here. And it's a size 4-0. This is another type of suture, which is a proline or a polypropylene monofilament. So the difference between braided and monofilament, the braided suture is made out of really small filaments that are braided together, just like a silk suture or just like a thread. A monofilament is literally just one filament or one piece. The one piece. One piece of thread. Okay. This is a non-absorbable suture. This is proline. And this is very small. And this suture is kind of special because it's double-ended. So both ends of the suture have 2 needles. This one also. This is like a bigger version of it. So this is a round needle. Okay. I remember the monocryl one since we basically purchased 3 the night before my mother's operation and we had to go through multiple pharmacies. Oh, monocryl! Yeah, monocryl suture, I don't have a sample. But monocryl is an absorbable suture. And it's monofilament. Okay? I don't have a sample of that though. The usual ones I see are these, but monocryl is basically the same. So these ones don't dissolve. These ones dissolve because these are, oh wait, these ones are the non-absorbable sutures. These ones here are the absorbable sutures. I don't have monocryl because I tried digging around, I don't have it. So yeah. The ones I have are expensive and I didn't want to really open that. Okay. Let's go to, before we go, let's go to the instruments I'll be using. I'll just go through this one briefly. So, what does monofilament mean in this usage? It just means it has one piece of thread, unlike the braided where it's multiple threads and they're all braided together. Okay. So, I have this one is a needle holder. Okay. This is what we used to hold the suture with. Let's show you here. Yeah. Needle holder. It's a little used. And I have a black one. This is my black needle holder. I only use this, I rarely use this. Only the worthy ones use this. Like, not every patient gets sutured by this black needle holder. I like this needle holder just because it's black and it looks cool. These are needle holders, okay? Those are like basic needle holders. There are different types of needle holders, but I'm gonna be using this. And the rest here, I can't show you all the rest because some of these have my initials on them, so I will only show you the ones I will use for the suturing. So this one is a DeBakey. It's called a DeBakey forceps for picking up things. DeBakey forceps. And the other one I'll be using, this one is called an Adson. It's also a forceps for picking up tissues. But this one has teeth at the... I don't know if you can see it. There. This one has teeth at the tips. You can see that. Okay, this is for picking up skin. Okay, this is for picking up skin. Unlike this one, the Bakey doesn't have the on the tip. Well, it has like a little small ones, but these are not as traumatic as this ones. Okay, so yeah. Not the baby, it's the Bakey. And yeah, we'll be having. Okay, we'll be using this. This is the scissors. You all know this, but we call this the curved Mayo scissors because it's curved. It's a curved scissors, and it's called a Mayo scissors. Hybrid. Wait, I think... Can I show this? Oh, no, I can't. Okay, never mind. Oh, wait, let's take out this non-absorbable. Let's take that out of the... Let's get that out of the way. Okay. Alright. Hold on. Let me put this on the side, and we're gonna get... Yeah, Mayo. There we go. Now, you all saw this on Twitter. What's the point of the scissors being curved? It is, if you're trying to cut something that is very deep inside a patient, like the abdomen, you would prefer a curved Mayo scissors. Because if it's straight, you won't be able to reach places that you can't reach. You know, like for example, this one. If it was deep, if something was deep inside and I wanted to cut something, it'll just be straight. I can't cut it unless it's curved. You know, all you gotta do is tilt it a little bit and you can curve and you can cut things. Alright. Now I made people guess what this was. This thing. Okay. I assume the non-absorbable can't be used for internal sutures. That would depend. That depends. Okay. This is a silicone pad for suturing. I showed this on Twitter, and a lot of you got it right. Okay? A lot of you got it right. Now, we're gonna start with the most basic suture. Let's do here. I need to zoom this in first. Let's zoom in the camera. Hold on, okay? Let's see. What? Sorry, I have to zoom this a little. Okay, I think I can only do a 2x zoom. Okay. Here we go. I can only zoom that much. Okay. Alright, okay, let's pick one. We're gonna pick, Let's use the Novasin 4.0. We'll use this one, because this one's about to expire. So I'll use this. Or no, not really that it's about to expire, but it's actually not sealed properly, so I can use that. Wait, is there another one that I can use? Alright. Let's show this. Okay. And we'll use I'll use my black needle holder. Wow, okay, this is actually kind of hard to hold with these gloves. I can't. This is actually challenging to hold a needle holder and stuff with these kind of gloves. These are really not suitable for suturing. But anyway, okay. So, this is a polyglactin suture. I don't know if you can see it. It's too small, but yeah, this is how this thread looks like. Oops. This is how it looks like. Okay. Now, alright, then, how do you put the needle into the needle holder? So, first, this is the needle. Look, I'll show you guys the needle, okay? This is how the needle looks like. And if you, look at the tip, I don't know if you can see it. It is bladed at the tip, okay? It is bladed. This is a 4.0. Alright. Now, for those who want to learn how to suture, this is how the position of the needle is supposed to be. Okay? I don't know if you can see it. I have to show it. It's hard to... Here we go. Okay? They call this the sweet spot. You know if someone is pro at suturing when they know how to set their needle in the needle holder. So, what they say is 2/3 away from the edge. 2/3 away from the edge and slightly tilted upwards. This is how a suture is supposed to be positioned. I don't know if you can see. Ugh, there we go. Is it seen? It's blurred. It's blurred. Oh, there we go. There we go. Okay. And my phone just turned off. My phone turned off. Okay. Let's use this. Normally, when I would suture skin, I would use the Adsen. I would just use the Adsen because it's easier to, like, you know, hold on to the skin. But then, I don't know. I feel bad for this silicone. I want to know how you hold the needle holder. Do you put middle finger? Oh, that's a good question. Okay. You will know a surgeon is pro. That someone is pro when they hold the needle holder like this. This is how I hold the needle holder. And actually, not just me. This is how surgeons hold the needle holder, like this. They don't put their fingers inside. Or they rarely do. They don't hold it like this. If you see someone hold a needle holder like this, they are new to suturing. You can tell they're very new. Okay. I hold it like this. Why do I hold it like this? Because it's easier to maneuver the needle holder. Because when I hold it like this, I could just, you know, suture like that. And if I want to let go, I have to do that. Just push on it and I let go of the needle. And then just... See? Okay. And others do this. Why do you even have the hole? Because this is usually easier to do for right-handed. There are surgeons who are left-handed and they cannot do they cannot do this. They cannot hold a needle holder like this. So they have to use the holes. So if a surgeon's left-handed, he'll need this. Okay. Besides, look, see, sometimes I do hold it, like, for example, if I'm going to pick up a needle holder, I would hold it like a scissors. Okay? But, once I start suturing, I hold it like this. Okay. So, I don't know if you guys will be able to see. Maybe I can make this larger. Hold on, let's make this larger so you guys can see. I'm gonna make myself smaller. So you guys can see. So you guys can see. Okay, there we go. And then I'll make this larger. Okay. There we go. That's better. Ooh, Esculapius, thank you for following. Alright. I don't know if you can see it is better. Can you guys see? I'm small. Yeah, I made myself small. I think I should make myself still smaller. Make myself smaller. Ah. Make myself even smaller. Okay. Yep. There we go. I think that's better now. Alright. Okay. I'm gonna suture. I'm gonna do... Okay, this one, the one I'm gonna do right now is called the simple interrupted suture, okay? This is the most basic suture technique, okay? Simple interrupted. Oops. Ugh. Okay. Alright. Simple interrupted, so this. I'm gonna do one, okay? So I'll just do this. And this one. And then hold it here, and then I just pull on this. Okay. Until I get nearer to the edge. This is so long. Okay. Sometimes what I do is I like roll this like this. Oh my gosh, it's hard to suture in these gloves. Okay. Right. There we go. I don't know if you guys can see it. And then do 2 throws and then tighten it like that. And then another one. Oh. Oh, this one's loose. This one got loose. It's actually harder to suture with these gloves. But you get the thing. I usually do like 3 knots. I should use a larger suture for this. How do you measure distance of a wound? What do you mean by that? I should use a larger... I think I'm gonna use a larger suture. I don't think you guys could see it properly. Okay, let's put this on the side. Let's use a larger one. Let's see. Let's use this one. We'll use the Vicro Plus 2.0. Okay, yes, this one has a bigger needle and a bigger thread. So yeah, this is the thread. It's bigger than the other one. If you compare it to this one. Let's see. Wait. This is a lot bigger. Is it seen? I don't think it's seen. It's blurred. It is blurred. There we go. There we go. This is a 2-0. And this is the 4-0. I don't know if you guys can see the difference, but the 2-0 is a lot larger. There we go. So this one is the 2-0, and the other one here is the 4-0. Okay. I think it's better. Alright. Simple interrupted is just really simple. You just like go through and through. Like one bite, do this, go through, and then oops. There you go. I think you can see that one better than just 2. I do 2 because this is a surgeon's knot. Okay, 2, and then you just do this, tighten, and then you do another one backwards. And 3, and then just cut it. Okay. So usually when you're suturing, you only do like you usually have at least three knots. The first knot is a surgeon's knot. So I'll show you. So like for example, once you bite here, once you go through the skin or whatever you're suturing, okay, there we go. This is it, right? Every time you suture, the first one is always double, like this. 2 throws, and then there. Tighten. Okay. And then when you tie the other one, you go the other way, and then there. And this is the third one. There. And then you cut it. Usually when you cut 1 cm. Alright? So these are this is simple interrupted suture. So I don't know if you see it. There we go. So this one is a bad one because it was loose. This one's a little better. This is the good one. Okay? Because the skin closed. You can tell a suture is bad because this didn't close, but these are better. Okay, that's the simple interrupted suture. Alright? Okay, the next one is... Okay, the next one... Next we'll do a vertical mattress. Vertical mattress. Vertical mattress suture. Okay. Vertical mattress suture. I will show you. Okay. This one's a little more complicated, but a vertical mattress suture is very useful for, you know, for tense, when the skin is too tense. Okay? So this is how it's done. So first, first you're gonna go here, you bite like normal, like the usual. Go through here and then here. Okay. Just like a simple one, and then I'm just gonna pull it until, yeah, there we go, until the other end is short, and then after that you have to switch the needle position to the other way around. Okay, a while ago my needle position was this way. This is how I started, like this, right? Oops, like this. But now, this time, after you go through that, you're gonna switch your needle position to the other side. So, this way. Because you're gonna go backwards. So, oops, let's put this here. You're gonna go back from where you came from. So, here. But you're gonna suture right next to where you came out. So this is where you came out from. You're gonna suture right near the edge of the skin. And then you see why this is why I don't hold the needle holder. I don't put my fingers within the holes. Oops. Wait. It went too deep. Okay. There we go. Okay. There we go. This is a vertical mattress. Alright? And then you tie it again, like this. Okay? Oops, this one. There you go. And that's how vertical mattress suture. See, this is why I don't hold the needle holder like, you know, like that. Because when it's easier to like curve, it's easier to curve into the wound when you're holding the needle like holder like this. So you just pierce through the skin and then just curve it like upward like that. And then when you're done with it and then you're going to go the other way, it's the same thing. You don't hold it this way, because if you hold it this way, you're gonna have to like, see, you're gonna have to switch, you know, move your hand more. Unlike here, if you're holding it like this, all I have to do is just curve it, and then I can just, you know, like that. Curve it, and we're good. Unlike, like this. Okay. Let's do another vertical mattress. So, let's do another vertical mattress. So, here. There we go. So, first you bite there, and then you're gonna switch the needle to the other side. Okay. And then, yeah, you're gonna go back. You're gonna go through the edge. And then just like that. There. And let's get the end of the needle. And then I'm gonna tie it. So that's 1, 2, 3. And I put it. Okay. That's the vertical mattress. Okay, so here's how it looks like. So these are the simple interrupted sutures. This is the vertical mattress. Okay, these are good for like tension. It got blurred. There you go. See? It's blurred. It's not focused anymore. There we go. There we go. Yan. These are the vertical mattress. Okay? These ones are a little hard to cut off. Okay. Okay, let's go the other way, this way. Alright, let's see the chat. Oh, Daikon Warrior, thank you for the sub. Can you explain the steps again? Without demonstrating? What do you mean? Like, which one? The vertical mattress? Like I said, all you have to do is just bite from one end to the other edge until you reach the tip of the thread. And then, after that, you switch the position of the needle to the other side and then go backwards. This time nearer the edge, and then you tie them back together. Then you tie the ends together. Okay. All right. The next one is horizontal mattress. This one, someone said they were practicing that and they got they had a hard time with it. I rarely use this one. Horizontal mattress. I rarely use this suture. I only use this for like, oh, someone followed me on Twitch. Thank you for the follow on Twitch. Anyway, oh, check this out. Horizontal mattress, I barely use these. I usually use horizontal mattress when I'm suturing muscles. So, let's see. Okay, we'll do a horizontal mattress here. So this is a horizontal mattress. So again, you bite like the usual from one end to the other. Okay. There we go. Let's, oh. There we go. Okay? And then again, like vertical mattress, you have to flip the needle around. Just like that. Okay. And this time, instead of biting right next to the, you know, the same parallel, right next to the where you brought your needle out from where you exited, you go down. You go down one, like, probably half a centimeter, and then you go backwards. Okay. Oops. Go backwards, and... Yep, there you go. And this is a horizontal mattress. And then, so what happens is, look, the thread is right next to each other on one side. Unlike in vertical mattress, they were like right next. One is nearer the edge of the skin, and the other one is further. This one, they're like parallel to the wound. Okay. Does it hurt when not using anesthesia? Yes. Imagine getting pierced by needles multiple times without anesthesia. Okay. That's how it feels like. Okay, so I'm gonna show you. This is the horizontal mattress over here. Okay. Unlike the vertical mattress here. And this is the simple interrupted. There's like a little thread. What kind of sutures do you use in hernioplasty? For the skin, I use for the skin, I use polyglactin sutures, Novosin, and I do a different suture technique, not this. Okay, I will show you another one. Okay, Some people were talking about continuous, right? I will show you a continuous suture. I'll be using this. We're gonna be using this, and we are going to suture this one right here. Okay? Continuous suture is self-explanatory. Hold on. Let's see. I will change this to continuous. Okay, I'll show you continuous. So here we have. Yes, you would feel the thread going through your skin if you don't have anesthesia. Okay. We'll do this one. So for a continuous suture, it's self-explanatory. You just go continuously, but you have to have a secure first knot. So it's just like a simple interrupted. You go like this. Okay. And then you have to secure your first knot and make sure that it doesn't loosen up. So just like a simple interrupted. It's just like a simple interrupted. Oops. And then I usually cut this, I shorten this one. Okay. Oops. And then this is a continuous suture. Usually you have an assist. The assist will hold this other thread like that. The assist, you have an assistant holding the thread like that. But since I don't have an assist, I have to do this. I have to make do with what I have. So this is a continuous suture, okay? You just continue, it's like doing multiple simple interrupteds without cutting them. So you just continue. Yeah, and then that. It's really just continuous. Some people who are not yet good at suturing continuous, they would usually like do this and hold the needle. They would hold the needle with the pickup. But for me, I don't really hold the needle anymore. I just go straight. Some people would like do this and fix their needle, but me, I just go straight. Like that. I will just go all the way. So you know they would do this, they would hold it like that and do this. It'll take longer though. So I've mastered the art of like doing continuous sutures without having to hold the needle with my left hand. So yeah, look, just go that and then just do this. Okay. Okay, this is the last. Wait, no, this is second to the last one. Okay, this is the last one. We're gonna tie this. So this ends the continuous suture, continuous one. And then all we're gonna do is just tie it. Just tie it. Like normally. Tie it. Okay. And cut. Okay. And that is a continuous suture. Here we go. There. Oops. I don't know if it's C. There we go. This is a continuous suture, so we have the continuous here. And then these are the interrupted. Okay. Usually we use continuous when we're closing the fascia, which is like an inner layer of the abdomen. Okay. Instrument tie is better than hand tie. Well, yeah, of course. Instrument tie is because you can reach places you can't reach with just your hands. How do you deal with tough skin with incredible lack in elasticity when it comes to pulling the needle back out? Or is it basically not humanly I force the needle! You have to use a cutting needle. Usually cutting needle will get through it. If you use a round tip needle on a skin that is not elastic enough, you're gonna have a hard time. And you also, the brand of the suture is important actually. There are some brands that are really shit. I don't want to mention the brands, but there are some brands of sutures that are so shit. Okay. So we have this close here. Put this on the side. This here. Okay. Next, okay. The next one I will show you is the type of suture that you don't see. Okay? So far, the sutures I showed you are stuff that you would see. Like, if I sutured your skin, you would see the suture. But then there's also the type of, suture technique where you don't see the suture at all. And that, the first one I will show you is what we call, inverted T. This would be useful for those who have a hard time with like elasticity on the skin. So let's see. Where will I do inverted T? Inverted T, maybe I'll do it here. I'll do it on this one. Okay? I'll do it on this little one. This little thing right here. Or, yeah, one of these. Okay? For an inverted T, we always use absorbable sutures because these are the ones that you don't see on the skin and you have to let them absorb. So, unfortunately, I used the absorbable suture we have. I already used it, so we're going to pretend that this is absorbable. This is not absorbable. This is not absorbable. So, I used the wrong sutures. When you suture the skin like this, you're supposed to use non-absorbable sutures. Okay? But then, since I don't have a large non-absorbable suture, I used absorbable. If you're gonna suture something and the skin, and it's going to be a technique wherein you don't see the suture at all, you use an absorbable suture. The only absorbable one I have here is a 2O, but that's way too big. We'll use this. Pretend that this is absorbable. I used the wrong one. Okay. Is super glue good for closing wounds? Bruh. There is a... Oh, is this assistant commenta? Oh, okay. There is actually a special type of glue for suturing. For closing wounds. It's not super glue though. Okay. Usually when suturing the skin, you use a cutting needle, especially with a cutting non-absorbable suture for suture techniques wherein you're gonna see the suture. But if you're going to use a suture technique wherein the suture is not seen at all, this is a silk suture, by the way, which is non-absorbable. I should be using absorbable for this, but yeah, I ran out. We're gonna do an inverted T here, okay? So, for an inverted T suture, instead of starting on one edge outside, you're gonna start inside from the... You're gonna start inside. So, you have to have a good grip. You have to have a good grip on the inside. You hold the skin and show the inside. And then, you have to suture from inside going out at the edge of the skin. Okay? It has to be at the edge. And it shouldn't go past the edge. So, let's see. This one. There we go. That. Okay. And then you're gonna suture the other side the same way. You're gonna suture the other side the same way. But since you went inside going out, your next suture will be outside going in. So you hold the edge of the... You're gonna hold the edge of this, the other side of the skin. Oops. And you're supposed to have an assist to help you, but I don't have an assist, so... Let's put this down here. You hold the other side, the other edge, and you have to suture the edge. From the edge and inward. Like this. Oh. There we go. Oh no. There we go. There we go. And then you have to bring out the needle. There. Oops. Okay, and then... Alright. So, after that... Why is it called an inverted T? It's because you make a letter T, but it's inside the wound. So, this is how it looks like. So you have this, and then you're gonna have to tie it. Tie it. I tied it bad. This is actually hard. Wait. Hard with these gloves, actually. Oh, it cut through. Oh no. The needle was too thin. It cut through the silicone. Oh no. Ah. It cut through the silicone. Oh no. Let's put this on the side. I'm gonna use a bigger needle. It's cutting through. I'll use this, okay, just to show you how the suture is, This is very big, though. Oh, man. Oh, hey, this one has white. This one's colored white. Look at this. This needle is, like, thicker. This is a thick needle. This is a very thick needle. Bruh. And the suture is white this time. Yeah, I don't have surgical gloves, unfortunately. Okay, let's do this again. I'll do it again. This time I'm using a 2-0, just so you guys can see. So, again, so you go here and go out through the skin. Through the edge of the skin, I mean. And then you're gonna have to go the other edge parallel to where you inserted. Let's go this. Do it here. And there we go. I think that's better. I think this will hold better. So... Ah. Let me tie it. This is actually harder. This is hard because the knot is slipping. This one is a fail. I'm sorry. This one is a fail. This one is a fail with the scissors. When you cut this one though, the cut has to be very close to the knot, because what is supposed to happen is it's supposed to close like this. But yeah, we're failing. Hold on. Let me get rid of these. Okay. I'm late, but how are you, Doctor? Good to see your medical stream. Hello, Verdant Aryan Rod. Hello, I'm good. Alright, let's do that again. Ah, inverted T suture. Do that again here, and then has to be tip. There we go. So this is how an inverted T is supposed to be, but it's hard to do it on silicone. It's hard to do it on silicone. I'm having a hard time with this. Okay, do it again. And then suture. Oh, it cut through again. Yeah. This is actually harder because the needle is cutting through the silicone. So it's actually not easy to suture this here. Let's try one more time. There we go. Alright. But I think it cut through again. This is actually not easy to do on silicone. Yeah, look, it cut through, so I can't really, it didn't suture well, but that's how an inverted T is supposed to be like. Okay. Yeah, it doesn't have to be perfect. Alright, the next one I'll do, the next one is subcuticular. So if there's an interrupted one, there is also a continuous one, which is subcuticular. This one, I like this one. I like doing this one better. And we're gonna do a subcuticular on... let me do it here. This needle's too big, so we're gonna use a smaller needle. Let's use the Vicryl. Let's use this one. Polyglacryl. Use this, because that's what you're made for. Alright, we're gonna do it on, I wonder if I can do it here. Probably do it this way. But it requires also to do it on a, do an inverted T. You start with an inverted T also. Then you do a subcuticular. So just like what I was doing a while ago. And then, so after that one side, you go to the other side. Oops. Bruh. Did we go through it? Okay. I think... There we go, yeah. There we go. And then we'll just do... I couldn't really suture it, tie it properly because of the silicone. But anyway, I will show you how a subcuticular is done. So when you cut the other end of the suture, it has to be really close to the knot. Okay. Magandang gabi, ShioriPon. Hello, OZST. Hello, hello. Okay. For subcuticular, you're supposed to have an assist, right? You have to have an assist. Holding this for you, but since I don't have an assist, I have to do it without it. Without an assist. So this is a subcuticular suture. I like doing this actually. For like if I want the skin to be like really nice, here I'll show you. This is a subcuticular. So what you do is you're gonna follow the edges of the wound. So this is one side. I did one side. And then I'm gonna suture the other one. And this time, your needle is not going across. It's going downwards. So see, I went one side. I'm gonna go here on the other side. Like this. And I'm gonna stay at the edge of the wound. I don't go deeper. I just stay at the edge. Oh, Meow, thank you for the $2. I need to go. Good now, good night. Thank you, thank you. Thank you for the $2 on Gank. Thank you. Have a good night. Alright. Oh, shit. Thank you for the sub. Alright. Okay. I got it. I think, is it starting to close? Wait, hold on. There we go. I think it's gonna start closing. There. It's starting to close. So you just do it continuously until the wound closes. See, just like that. Man. So, there we go. If I pull on this, it's supposed to close. Bruh, I can't hold it. There, see? If I pull on it, it's closing. Okay. I just got in the stream and my recommended. Slightly curious, but are you actually a surgeon? Yes, I'm a surgeon in real life. I am a rogue surgeon VTuber. And I am also a surgeon in real life. So I am teaching people how to suture. So this is the subcuticular. Go through the edge of this. There, it's starting to close, right? You see that? This is how so if you compare it to the other sutures, this one takes a while. Needs more like skill or technique compared to like the continuous and the simple interrupted, because this one has to be really, you have to be really good with your technique here for it to close nicely. Oh. Hey Diyoshi, thank you for the sub. Thank you for subscribing. Okay, cool. He's suturing the tule. See, look, it's starting to close now. Let's do this all the way at the end. Okay. It's hard when you don't have an assist. Yeah, it's actually harder when you don't have an assist. So look, see, every time I suture, it has to be like parallel or perpendicular, parallel to the previous suture. So yeah. So sometimes I make it slightly higher just so it closes properly, because sometimes it doesn't. So it's like an invisible stitch. Yeah. These are the... When you use these, you have to make sure you're using the absorbable sutures, okay? So this time, right now, I am using an absorbable suture. So I am using the correct suture this time. So a while ago, I just did with whatever was good. And then I'm gonna show you the difference between this and the others. See, it's closing up, right? Except this one, because my inverted T was shit. We're almost there. There, look. See, we're almost there. We're almost at the end of the wound. Okay. The closure of this one is a little different from like the usual though. Oh shoot, I cut through the skin. cut through. It cut through! God damn it. Okay. There we go. There we go. Alright. When you tie this, it's tied differently. Thick FBI. Thank you for following me on Twitch. That is a Twitch follow. Oh. This is it. This is how I close this. I have to hold it like this, like a loop, and then I just... This one. This is how I close this. Oh no! It got cut! I wasn't able to... Oh well. I'll just tie it up instead. I'll just tie it up instead like this. Like a simple interrupted with a... But this is not how I usually tie this. When I end this suture, the knot is also inside instead of outside. It's just that this thing is just giving up on me. It's breaking. Oh, Idioshi has followed me on Twitch. Thank you for the follow. Oh. Uh-oh. Oh, shoot. Oh no, I didn't notice my needle got stuck. Oh no. Oh well. Let's pretend that didn't happen, okay? I'm gonna cut this now. We're gonna pretend that didn't happen. But anyway. Here we go, look. This is the sutures inside. So if you compare it to the others, the continuous suture over here and the interrupted sutures over here. Yeah, you can't see the suture here anymore. This is the subcuticular. Okay. There you go. For comparison. And it's not focusing. Focus, camera! Focus! My camera's not focusing. It's not focusing. Oh, there we go. See? There we go. This is the continuous and the simple interrupted vertical mattress and horizontal mattress, and this is the other one, and it's not focusing. There we go. Subcuticular. Okay. Our little secret. Yes. What's the most stressful part of suturing? Probably when you're trying to anastomose bowels, like when you have to connect bowels together, that is very stressful because you gotta make sure your sutures are perfect. And that one is actually a lot tougher to do. If I can probably do another stream about that next time, or just make a video. Maybe it's better to make a video out of that. Actually, there's still many different types of sutures techniques. There's a lot. Like, for example, we have the where's the 2-0? The figure of 8 suture, which is good for like bleeding, for bleeding. Like something is like, for example, if something is bleeding and you can't find it, you can do a figure of 8, which is basically two bites that are continuous, and then you tie them together. So yeah, for example, it's like this. So you do like a simple interrupted. Oh wait, I forgot to say. This is a figure of 8. Sorry. Figure of 8. Okay. There we go. Figure of 8. So you do this, you bite there, and then oops. There. So it's like a simple interrupter, right? But instead of tying it, you're gonna bite again below it. In the same level. Or the same, parallel to the first one. There you go. So pull it. Oops. There you go. And what happens is, after that, you're gonna tie it together. So, this is a figure of 8. I will show you. So it's like a simple interrupted. This one here. There we go. It's like a simple interrupted. But you have two throws. Okay. That sounds scary and intense, but I bet you're amazing, and thank you for always being so informative. Okay, yeah. Suturing bowels is really stressful to me. Anything where you have to like connect two things together, especially if it's intestines or let's say bile ducts. You know, that is stressful. That is very stressful. Okay. So yeah, that I guess that's all the sutures. Alright, so let's see. Do you guys have any questions? Let's go. I'm gonna turn this off. Thank you for the subs. Uh-oh, wait, hold on. Okay. Alright, do you guys have any questions? I'm gonna put the chat back. I'm gonna put you guys back. Let's put you guys back on the... Oops. Ah! No. Where's YouTube chat? YouTube chat. There we go. Hello, chat. Nice zooming. I made a mistake, okay? Konbanwa sensei. Hello, what's this? Zafur Zafurakaru. How do you suture old people's skin since they're loose? It's the same thing. It's simple. It's just the same. It's just you just have to make the edges match, or you know, you have to have the edges of the skin opposed to each other. You know, opposed, like they have to meet. The edges have to meet. The edges of the suture have to meet properly. Were you more afraid or more excited to do the actual thing? What gave you the strength to overcome the fear? No, actually, I was not afraid to suture. Well, skin in general, I'm not afraid to suture, like skin, because it's just skin. I get excited. But when it comes to like suturing bowels or let's say blood vessels, that's scary. That one is scary. That one but you know, I have to get it done. So I practice. How much does suture cost on average? Oh, that depends. Here, let's see. The cheapest one would be silk sutures. Like, but they're still expensive, you know. There is no suture that costs like less than like 200 pesos. There's gonna be sutures that are like 200 plus pesos, 300. There are some sutures that cost 900 to more than 1,000 pesos. More than 1,000 pesos. And it depends on the suture. So silk suture is the cheapest one. And one of the cheapest one anyway. Vicryl, like the purple one, the purple sutures I showed you, those can reach like hundreds of pesos. Monocryl also is the same. Well, I'm gonna, because I have some practicals on gross anatomy class. Okay, have fun in your gross anatomy class. Make sure you pass. Pass your class. Longest suture you've ever done? If I'm gonna suture something really, really long, especially if it's on the skin, like if it's very long, I would just use staples. But if it's like hand suture, like what I showed you guys, the longest I've done is anything. An exploratory laparotomy, which is like a wound on the abdomen, midline, like from like under your rib or the center of your sternum, under your sternum all the way down to like your pubic area. That is long. Meron sa Shopee murang nylon. The Shopee ones, don't trust those. Those are shit. You gotta look at the brands. Actually, when it comes to sutures, you have to look at the brands. I'm sorry. You have to get like the B Bronze or the J&J's and the... Ano yan? Medtronic ba yun? May Medtronic. No, not Medtronic, but you know. There's some sutures that are really not good. Doc, ang tuli ba may suturing? Yes! We use chromic sutures or chromic gut sutures. Like when you cut the foreskin, that's when you have to suture the edges. So yeah, there's suturing. Is it the GI or the surgeon that does ligation for varices? That would be a surgeon. Varices, like varices for what? But it depends on what you mean by varices. Because if you say like varicose veins in the legs, that would be done by a vascular surgeon. Either they're fake or they don't do what they're supposed to do. Oh, you mean like the ones in Shopee? Yeah, some of them are like really. It's not that they're probably fake, but some brands are just really shit. There are some brands that are a lot better, and there's some brands that are really bad. Okay. Oh wait. I'm gonna move myself. I will zoom myself more. Zoom! Okay. So my face, you can see my face. Any more questions? Is surgical glue cheaper than regular suture? No! I looked up surgical glue and it was 2,000 pesos for one glue. For one tiny, like 5 ml of glue. It's 2,000 pesos. Okay. So yeah, no. Definitely not cheaper. It's a lot more convenient, but not cheap. It's expensive. Anyway, I hope you guys learned. You guys learned a lot. Yeah. Did you guys learn a lot? There's a lot of other suture techniques and other sutures, but like a stapler. I don't have a stapler. Stapler is expensive, but it gets the job done. When do you use glue? When it's available. Or, you know, glue is best used on pediatric patients. Like, for example, they have wounds. For example, they have wounds. And if you want to spare them the trauma of getting needles poked into their skin, you can use the glue. Doc, aside from sutures, ano naman yung tinatawag nilang staples? It's staple. It's the same. Staples. Stapler. Does it hurt when you use glue? No, it does not. You practice my suturing more than... Yeah! You know, suturing, you develop the skill by practicing. So, it's something that you can watch and learn, but then when you're actually doing it, it feels different. Especially if you're just practicing the suture in like a suturing pad. It's really different when you're doing it on an actual person and when you're doing an actual surgery. It's really different. Even the feel is different. Like this silicone pad, I mean, it's good for practice, but when you're actually doing the suturing, it's totally different from other, you know, from actual skin, actual tissues. It was a very good stream, yeah. You know, maybe next time I can do like bowel anastomosis stream, but I don't know. I don't know if I could do that because usually when you do bowel anastomosis, this is when you connect the bowels together. You use actual pig gut or pig intestine, and I don't think I can do that here because my room is gonna smell really bad. My room's just gonna smell bad. It's gonna smell like pig guts. Ew. Can you do sutures as a first aid? No, I don't think so. Like, if you're not... Maybe as a trauma, like in the ER, as that kind of first aid, yeah. But it's better if you... It depends on the wound also. You have to clean the wound properly and all that. Yeah, I can't. I can probably do anastomosis, anastomosis, but only videos. I can't do streams. I just have to I actually have a pre-recorded video of me doing suturing pig guts together. It's just that I didn't have the chance to like edit the video. I should probably check if I could like make something out of that. Alright. Anyway, yeah, I guess that's all. That's all for tonight. Thank you, everyone. Thank you everyone for coming to my stream. Thank you. I hope you guys really learned a lot. Okay? I hope you guys learned a lot. Thank you. Otsupon, guys. And, yeah. For those who... I think there's some people here on this stream who are new. Or, yeah, who are new. You can follow me on Twitch. I stream a variety of games. I am basically a variety streamer. I usually do my medical education streams here on YouTube. I try to make it a point to do them every month. It's just that the past few months I've been so busy. I've been so busy at work, so I wasn't really able to continue my medical education streams. But this time I think I can. If you guys want to see more of me, you can follow me on Twitch. I stream more often there, and what I do on Twitch is I play video games. I sometimes do chatting streams there. What else? Karaoke if I feel like it. But yeah, I frequent Twitch more. And yeah, I will schedule another medical education stream sometime soon. What's your usual schedule on Twitch? I usually stream at this time. I have one scheduled on Saturday. I'm gonna play Diablo 4. I also have Twitter. You can follow me there. I usually post my stream schedule there. I don't have a set schedule like, you know, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. No, because it depends on my schedule per week. But I stream at least 2 to 3 times a day. Not a day. 2 to 3 times a week. And Twitch. So yeah, I have one on Saturday, 9 p.m. Philippine time. And then every Sunday, I always post a stream schedule for the week. I post it on Twitter. I also post it on Facebook, on my Facebook account. So if you follow, you can follow me on Twitter or follow me on Facebook. I don't have a page; it's just an account. Because I used to have a page on Facebook, but then I don't know. I just closed it down because I wasn't getting any reach there. All right. I already followed you, but for some reason I always miss the stream tweets. Oh, you know what you do? Click the bell. Click the bell on Twitter. Twitter's weird, okay? Twitter/X is just weird sometimes. Even when I follow other people, I miss things, you know? I miss things. But anyway, yeah. I got stuff to do. Otsupon, everybody. Have a good night. See you guys on Saturday on Twitch. I'm playing Diablo 4. I got that game for free and I won in a raffle and I haven't even played it yet. Alright, Otsupon, good night everybody. Bye-bye. Bye.